guys, basically in this video we're going to be speaking about osteoarthritis, and over here we're going to be speaking about it's a mnemonic of the risk factors. So we're going to be having the we're going to be having the modifiable and non-modifiable risk factors. So it's a bit of both. So for modifiable, or modifiable means any sort of risk factors that we can change, in that sense that we can, for example, um, not for this osteoarthritis, but for example for esophageal cancer, smoking may be a modifiable risk factors, because we can remove that from our lifestyle and we can modify that. So over here the same thing. So the really mnemonic for modifiable risk factors of osteoarthritis is OO. So O over here is going to be obesity. So of course someone can go improve his diet or go to the gym, lose their weight. So it is modifiable. Other one is overuse. So overuse, excessive load on your joint, kind of putting all of that load and pressure on that joint. By the way, guys, all this info that I got over here, I have to give credit. Credit is due. Credit is going to be given to Amboss. I've gotten not majority, if not all, information is paid from Amboss. So that's just a bit of a side note. But obviously the mnemonics I've completely made them by myself. So the fat. The next thing is non-modifiable. So these are risk factors that we cannot change. So fat. Why are we going to speak about fat over here? Because fat is going to be basically patients with osteoarthritis are usually fat. They're usually overweight. They have a high BMI, and that's how they get problems in their hips, their hands, their knees. In these type of joints, they get really hips, hands, knees. They really get a lot of problems. So over here, non-modifiable is fat. So F as in female, F as in female. A as an anatomical problem. So anatomical problems, this can be, for example, congenital acetabular dysplasia. So there can be acetabular problems over here. The next thing is going to be the F as in female, F as in family history, A as in age above 55. So these are quite females who are slightly overweight and who are above the age of 55. Next thing will be anatomical factors. So these can be any sort of anatomical problems. So this may be some sort of congenital acetabular dysplasia, any sort of problem where they may be asymmetry, and they may be asymmetrical joint stress over here. So that can be the problem, and this can lead to congenital acetabular dysplasia. The T can be trauma over here, so someone gets some sort of trauma to the joints. The H over here can be hemarthrosis. So if there's going to be hemophilic hemarthrosis, so if there's going to be some hemophilic disorder in which we have a lack of a coagulation factor, this can maybe lead to hemarthrosis. So guys, just a quick overview. So modifiable risk factors is obesity and overuse. Non-modifiable risk factors are going to be fat. So female, family history, anatomical factors. There can be, for instance, acetabular dysplasia, the age above 55, trauma, and any sort of hemophilic hemarthrosis, so any sort of hemophilia in which we have a lack of coagulation factors, and therefore we're going to be getting bleeding into the joint. That can be a risk factor for osteoarthritis. So hopefully you guys found this useful. Thank you guys for watching. If you have any questions, please leave them down below. I'll try my best to get to them. Thanks for watching. I hope to see you guys next time.